So, as was said, my name is Theresa Landau, and I do go by the pronouns she and her. And I just wanted to acknowledge in a short speech or a short presentation, not a speech, I want to acknowledge the importance of inclusivity. And I might use the traditional mom and mother and not do breastfeeding, chest feeding throughout, but know that we are inclusive and we recognize that this applies to people who identify all genders, and our families are just very, very diverse. So I'm going to start off with telling you where I have lived basically for the past 45 years. But Gotham Health Morrisania has gone by many different names, but we just had this beautiful mural painted on the outside of our wall, so you can't miss us. But I have to tell you, my team and I fought really hard to get this breastfeeding picture and make sure that the baby was at the breast, not just sitting on the lap, because we believe that this helps normalize breastfeeding when it's right out there. Oops, am I going backwards? All right, let's see. Here we go. So the whole point of this, and I promise I won't do a breastfeeding class, and you got a lot of information already about breastfeeding, but why does breastfeeding matter? Let me just move this because I can't see with this thing there. There we go. Well, hopefully that's not in your way. Breastfeeding is not just a lifestyle choice. It is a public health imperative. And Dr. Melissa Bartek did a study more than a decade ago, and this still stands. And she found that if 90% of the women in the US breastfed exclusively for 6 months, the US would save $13 billion. That's billion each year from reduced medical and other costs. And around 911, almost 1,000 lives would be saved each year. This is in the United States of America. This is not in a developing nation. It matters here. And our own director of the same division that funds Bronx Health Reach said that breastfeeding provides unmatched health benefits for babies and mothers. It is the clinical gold standard for infant feeding, with breast milk uniquely tailored to meet the needs of a growing baby. We must do more to create supportive and safe environments for mothers who chose to breastfeed and who will choose to breastfeed in the future. And one of my heroes, grandmother of breastfeeding, Dr. Ruth Lawrence, says, and I love this quote because it's so true, particularly for the Bronx. Breastfeeding is the most precious gift a mother can give her baby. If there is illness, it may be a life-saving gift. If there is poverty, it may be the only gift. And 2 years ago, and I think this was a report from Bronx Health Link in the Bronx Times, just fitting with hashtag not 62, the Bronx has the lowest breastfeeding rate in New York City. And that still is true. And I'm so glad Alma is here, because Alma and Bronx Healthy Start convened a group to put together this wonderful campaign showing the Bronx and trying to normalize breastfeeding, chest feeding in the Bronx. And she did an absolutely wonderful job with the bus placards and the videos and everything. And thank you, Alma, for doing that. But chest breastfeeding support is more than just health. It's an equity issue. Regardless of the zip code you live in, of your race, ethnicity, educational background, schooling, how you eat, your baby who is breastfed will have the best start in life. It's the great equalizer. And when everyone is given the same information, everyone gets that great opportunity. The problem is that everyone doesn't get that same opportunity. Everyone doesn't get the same information. And peers are really important. People listen to, they associate with people who look like them and sound like them and understand them. That's why the peer counselor program and all the WIC programs is so valuable, and the home visiting programs as well. So I'm not going to go over the big, why is breastfeeding so important? I have to get rid of that thing. But we know that breastfeeding is an investment in health for the future. I always tell people breastfeeding is one of the only things, probably the only thing that I know in which you have an immediate impact on not only your baby, an immediate health impact, not only on your baby, but on the birthing person as well. Not only now and in the immediacy, but also a lifelong impact. I'm an RD, and I'll tell you, nutrition and breastfeeding is nutrition. Nutrition is really important, but other than illness and something like that, sometimes you wait years to see that impact. With breastfeeding, it starts on day one. As was said earlier today, no matter rich or poor, whether you live in Great Neck, Long Island, or in my area in the South Bronx, parents face obstacles. Just because breastfeeding is natural doesn't mean it's easy for every mother and baby. And that's why we need community support. That's why we need professional support. We need advocacy type of support. We need the workplace support. We need friends and family, because regardless, even of your educational level, there's a lot of lack of knowledge. There's lack of knowledge in the medical field. Doctors don't learn about breastfeeding in medical school. They should have a requirement for pre-service to learn about breastfeeding. It's critical. It's healthcare. And I'm sorry, but people don't look at it as healthcare. They look at it as nice, but it's healthcare. And then lack of confidence is one of the greatest reasons that a lot of parents don't reach their own goals. Lack of support, family, friends, community, medical team. Who doesn't need support? We have a new baby. I do. Everyone does. But we have to make sure there's not disinformation and misinformation. A lot of people are surrounded by people who didn't breastfeed. And now, and I'll say the hidden story out there, or the elephant in the room, there's a lot of mommy wars, and the formula companies have a lot to do with that, and saying, oh, it's all the same. It's not all the same. We will meet you where you are, but we want all of our families to make an informed decision, and we'll support whatever your decision is, but you have the right to have an informed decision. So hospital practices. Full disclosure, I am the chairperson of Baby Friendly USA, but Baby Friendly Hospital Initiative is critical, and we're so blessed in our borough that most of our hospitals are baby friendly. So they're implementing this 10 steps to successful breastfeeding. And step 10 says that when they are discharged, when families are discharged from the hospital, we have to make sure we have linkages in the community. Everyone doesn't qualify for WIC. WIC is fabulous. I've spent my life in WIC. But you need to have support in other places as well. And that's where our baby cafe is one of the reasons, one of the places we can, and the home visiting programs are fabulous. And then we need public policy, because right now there's a lot of lack of accommodation to breastfeed in the workplace, even though there are laws. It truly does take a village, as we know. And we've seen this kind of, social chart in a lot of different venues. And I'm trying to go fast because I know I don't have a lot of time. But surrounding that mother and baby are other mothers and babies and friends and family members and coworkers. And then our healthcare system surrounding that. And then up more breastfeeding advocacy, but also professional organizations, state programs, public health entities. And beyond that, we go into also public policy. It makes a difference. Breastfeeding is local, it's also national. And my fear is that we've ticked the box and said, okay, we did breastfeed, did that, done that, bought the t-shirt, and now we're on to the new greatest next thing. Maternal mortality and morbidity is in a crisis stage, and breastfeeding has to be part of that conversation. It really is involved in that. So we have this partnership. I love Bronx Health Reach. There's a mutual admiration society here. And one of the things that we've been working on for the past 5 years, and we are for that, hopefully, God willing, the next 5 years, but it's limited. We need to expand it. One baby cafe isn't enough, but it's our baby cafe. So I'm not sure if you guys are seeing my whole slide because I have all these, slide things over it. But what is a baby cafe? Well, it's a free drop-in service that offers breastfeeding support for pregnant and birthing people and breastfeeding people and non-breastfeeding people as well. And before the pandemic, we saw each other in person. We have professional support. We have other support. Mothers and dads got to talk to each other. They were out of a little bit of isolation, even pre-pandemic. They got to speak to each other. The kids played with each other. They got professional support. It was all wonderful. And then the pandemic hit exactly 4 years ago, last week or this week. And our team, not me, but my team, just pivoted that same 4 days later and created a virtual breastfeeding baby cafe. Our baby cafe is called New York City Baby Cafe Bronx. And we still do it virtually today, but we'd like to expand and have both virtual and in person. We do a working family edition as well. Everyone's not available in the middle of the day. For the virtual one, we have to separate Spanish and English because you can't just do both. It just takes twice as long. So we separate it out. But we have such a great reach. We've had moms and dads who just gave birth the night before and they're in the hospital and they join us, or people who have moved away and they're in other countries that join us. They share their experience with the new people who come in. Come on, baby. Let's go here. Sorry about that. Here we go. And who's invited? I stole this from our leader, Judy, because she was putting who's invited. I said, yeah, people need to know that. Well, everyone's invited. Pregnant people, breastfeeding, and other postpartum people. We help you wean. We help you in the beginning and whatever decision you're made. Family members, professionals, other breastfeeding people. And I told you some of what we do, but our leaders have a topic of the day and present on that. But in addition to that, people come with questions. They ask you, how do I breastfeed so it doesn't hurt? I heard that it hurts. Or they'll ask, how do I breastfeed in public? I'm afraid to do that. They say, is it true that a crying baby means you don't have enough milk? And for heaven's sake, how do you know you have enough milk? We don't have see-through breasts. They ask us about weaning. They ask us about postpartum depression. They ask us how to go back to work. There's a list of 100 different things they ask us, and they have professional advice. So we make sure everything's evidence-based, Erin, but let's not lose those anecdotes because those anecdotal cases are critical. Sharing that information and dispelling myths and disinformation is very important. We have some testimonials. This is Cindy, a former peer counselor of ours. She's not the one that said this, but recently when we asked to say, what do you think of Baby Cafe? This person said, love, support, and care. And someone said just yesterday, I think, support when I went through so much at the beginning of my breastfeeding. And this person is an experienced mom who's working through weaning her 4.5-year-old. And someone else said, oh, Baby Cafe is super supportive of all the decisions that I wanted to make. And they were different. My route was different than those of my friends and family. I had no one to support me. but Baby Cafe helped me achieve what I wanted to accomplish. I'm not reading it directly because I see it's written weirdly. And she said it was very much needed and wanted. Someone else said a big, big, big thank you for all that's being done through Baby Cafe. And we had someone who was a lactation professional who joined us at the beginning of the pandemic and stayed with us for months and said, I think of it as help, support, and concern. And just last week, someone said to us, the group helped me with my baby's tongue tie, what exercises I should do so that she could improve her tongue development. I am very happy that this group exists since they respond to my many concerns excellently and with a lot of dedication and passion. This person did not qualify for WIC, was not referred appropriately, had no referral to deal with the tongue tie, and was about to quit when someone referred her to Baby Cafe. It makes a difference. And why does it make a difference? Because we have Baby Cafe rock stars. Judy Fram is our co-facilitator with Asa Golo. Judy is a recertified lactation consultant. Asa is one of my amazing peer counselors who studied a little further and became a breastfeeding counselor. And they work under the extraordinary leadership of our breastfeeding coordinator extraordinaire that many of you know, Carla Lewis. And Bronx Health Reach also helped fund our African Moms Fashion Show. And
Theresa, I am so sorry, but
okay.
I need to interrupt you as I'm watching our time.
Okay. I will I'll finish it in a minute. How about that?
You have 30 seconds.
Okay, I'll just go quickly. You can imagine what that is, and this is our dream team. We also did worksite training, and that's legislative policy. Samantha is going to talk to you about that, but we're going to continue our relationship. We have a lactation salon coming up, which is a discussion group, and I'll share these slides if you need to, which is making sure that the next generation of IBCLCs are people of color, LGBTQ plus community, and other marginalized people, because LCs in this country and in our city look like me. We want to grow Baby Cafe. We want to normalize breastfeeding. We want to support, but we want to make sure there's expert care for everyone. And, we just have to really do this together. If we work together, we will succeed. But people have to understand the importance, and we have to get rid of disinformation, because that's going to close us down.